I call the member for Holt.
Thank you, Deputy Speaker, and I, with pleasure, rise to speak to the Appropriations Bill number 1, Appropriation Bill 2, Appropriation Parliamentary Departments Bill number 1, Appropriation Bill number 5 and Appropriation Bill number 6. Deputy Speaker, in reflecting on the budget, and the budget that was brought down by the Treasurer just over a couple of weeks ago, what immediately struck me as someone who represents a large constituency in the outer suburb is the disproportionate bulk of heavy lifting that has to be done by those in the outer suburbs to address the budget crisis that this government talks about. But what also struck me, Deputy Speaker, at the same time, in reflecting on this, is that I do recall that in the previous government paid a very heavy price for a broken promise. And the broken promise in the public's mind was that there would be no carbon tax. In discussing this with a colleague the other day, this budget contains not one broken promise, but 20. I have never seen a set of circumstances where a government has misrepresented the facts so brazenly and so often and come to the community and said, well, you expected to make this sacrifice, particularly those people that live in the outer suburbs. And one of the things that I think that this budget does, it is a complete contradiction of the Howard government legacy. Because I think, in many ways, Deputy Speaker, John Howard got it right. John Howard got it right when he recognised the need to remove the fuel indexation excise in 2001 and increase family tax benefits to many families in my electorate. When we got into government, further developed the infrastructure needed for people that live in the outer suburbs through the BER and School Pride program, grants to areas such as the Chisholm, TAFE in Cranbourne, Casey Race, the Aquatic Centre, the Casey Athletics Track, the Casey Fields Playground, additional funding for much-needed roadworks, emergency payments to emergency relief providers such as the Cranbourne Information Support Service, Casey North Information Support Service, Casey Cardinia Legal Service. We created a headspace in Dandenong and we approved and we're implementing a headspace in Fountain Gate with a planned sort of early intervention psychosis centre coming over the top of those two. We also were committed to building multicultural community harmony. We did this through grants to the multicultural communities in my electorate. John Howard and Kevin Rudd understood that there's a risk when you move out to the suburbs, Deputy Speaker, which are developing and growing, but they don't have the social infrastructure that's required. Often they don't have the roads that are required to sustain the population increase. And to illustrate this point, if you look at a facility like Albert Park, for example, which is located in Melbourne, with its Olympic swimming pool, soccer, an elite track, a wonderful lake, a golf course, a gymnasium precinct, picnic grounds, no such combination of facilities exists in my area, with the exception of a laudable attempt by the Casey Council and the Casey Fields precinct. So, Deputy Speaker, in this budget, it is saying that if people make the journey in the outer suburbs to build their new life for themselves and their kids, they are being disproportionately punished. And frankly, they don't think that's fair. So instead of building and strengthening our communities, what this budget has done is basically cut people's entitlements and, I might point out, level of security, whilst curtailing people's opportunities. And one thing that John Howard did always talk about was the aspirational class and creating opportunities. Now, there's no doubt, Deputy Speaker, that the Australian economy faces challenges in providing levels of security required, like funding the National Disability Insurance Scheme and funding opportunities for young people through the Better Schools Plan, particularly when there are revenue shortfalls. But the challenge, and the answer I should say to this challenge, is not to destroy people's confidence in the Australian economy, not to eliminate opportunities, but to create opportunities and grow the economy and constrain expenditures in areas that don't threaten growth and families' capacity for opportunity. The biggest concern to me, Deputy Speaker, coming immediately out of this budget that was relayed to me, and my electorate comprises manufacturing workers, retail workers, trade workers, construction workers. That accounts for almost 40 to 45% of employment in my constituency. What these people do, Deputy Speaker, they use cars. And they don't get the fuel rebates that the mining industry gets or the agriculture industry. They don't get rebated for the petrol that they use. And as I said to you, and I'll come back to, in 2001, John Howard, knowing that he had a problem in the outer suburbs, removed this fuel excise indexation. Deputy Speaker, do you know what would have happened had he not removed the indexation? And I quote a very illuminating paper from the Parliamentary Library, that the current rate, as it stands at the present period of time of this excise and fuel excise, customs duty if you want to include that as well, is now 38.143 cents per litre. If the fuel excise indexation had continued before John Howard intervened, it would now be 55 cents per litre. So is that what this government wants? Because it's now reinstating and reinstating that fuel excise indexation. How on earth do you think that a price increase over that period of time in petrol from 38.143 to 55 cents per litre benefits people who rely on cars and their utes to get their families around and for employment opportunities? It's just crazy thinking. And if you look at the total revenue forecasts for it over the forward estimate period, it's about $4.15 billion, but as I said to you, $1.8 billion of that is rebated. But I don't represent a lot of mining workers, Deputy Speaker. I represent tradies, I represent construction workers, retail workers, and other workers, and a lot of mum and dads. They're driving their kids around the place. They're not going to get rebated. They're just going to be slugged with this fuel excise increase. And it does disproportionately involve people from the outer suburbs. It's effectively reinstating an outer suburbs tax, and I actually don't think that is fair. And I think the government should seriously be considering it, because the constituency that I represent is not silly. It is a wise constituency, and it knows when it's not being told the truth, and they certainly don't believe they're being told the truth with respect to the budget overview macro parameters, but also the reasons why they have to be targeted in this particular way. They just don't accept it. Another issue that was raised just right off the bat was the introduction of the $7 GP tax. Now, as I said, I have a lot of families in my area, and they do need to go and see their local doctor. So you raise the price of petrol, but then just to give them an additional burden, an additional tax, you put a $7 GP tax on their visits. And notwithstanding what I've heard, some pretty interesting comments from those opposite about Medicare being overused and overserviced, that's not what people in my electorate think when they have a sick child and they need to take the child to a GP, and they have two sick children. They say have to go to the doctors twice. They don't think that they're being overserviced by the GP. They're trying to make their kids well. They're trying to make sure that those kids don't infect other kids if there's an issue. And we have thousands and tens of thousands of young people in my electorate. When you have outer suburbs growth belt areas, they of course have a disproportionate call on general practitioners, because they need those practitioners, because there's nothing more important than the health of the kids, of the children. I've had two children myself where we've had to use those GP service. Was I overusing the service? It's quite a stunning values-based statement to be making. It's a statement that could be made by a party that represents those living in the inner city, not the outer suburbs. And I've spoken to GPs in the area, and they are mortified about this particular introduction of a new tax. I've spoken to Ariane Degent, Dr Stuart Rumble, and the psychologist Stephanie Chu, and a constituent, Helen Joliffe, about this. They say it affects everybody. It absolutely does affect everybody, and there is no compensation for it, regardless of what's being said. In addition to imposing this new tax on doctor visits, the Abbott government has decided to make the Medicare safety net less fair from the 1st of July 2016, cutting $270 million from arrangements and transferring these costs onto families. And the elderly, who are a group of people that have sacrificed much to make this country the country that it is, are already, Mr Deputy Speaker, not going to the doctors. Now, these are people that need to go to their doctors to ensure that the ongoing use of medications continue. Their conditions are continued. You save as much money by people going to a general practitioner and picking up an early diagnosis of an issue when you're at that age group, but particularly with people with mental illness. What are you saying to these people? That if you're mentally ill, that you should go and you're going to the doctor and you're actually trying to get an assessment or a diagnosis, and you don't want to go to a hospital ward Because believe you me, if you go to a hospital ward, an emergency ward, seeking some sort of understanding of what your condition might be in a mental illness, it's not the best way to go. Our whole health system channels us towards a general practitioner as the gateway keeper to the entire medical system. So young people with mental health issues going to the doctors and then having to sort of pay an additional $7, and the implication is, by the government, if they keep on going to the doctors, that they're actually using the system. It's a horrible, horrible values-based suggestion to make, and as I said, it disproportionately affects people in my constituency. Locals in Holt also found out that they're going to have an additional $100 charge to see a medical specialist, which is another hidden nasty. Now, in outer suburbs, in growth point areas, Deputy Speaker, they rely on public hospitals. And what we see in the budget in 2014 is that it cuts funding for 3 local hospitals that service residents in my electorate. Between 2014 and 2018, the Monash Health network of hospitals stand to lose $122,536,072, which includes funding to the Casey Hospital, the Cranbourne Integrated Care Centre and the Dandenong Hospital. Last year, in 2013, I think the previous Labor government there was a $107 million shortfall for all of Victoria. And there was a disagreement between the Liberal state government and the federal Labor government about funding. You know what it did, Deputy Speaker? As a consequence of $107 million for the entire state of Victoria, it started closing hospital emergency wards. They started basically going through the pathway of shutting people's access to hospital emergency wards. So if you take 3 critical hospitals in a growth network that were going to be closing their emergency wards when a much smaller amount of money was going to be taken out of their system, you've got a substantial problem on your hand when they get told that they're going to lose $122 million. Again, so what do I say to the people that I represent in my constituency? If you get sick, don't go to a GP, you're going to get charged $7. And if you go to an emergency ward at Casey Hospital, it might be closed. Because they're the measures that are going to have to be contemplated by the state government because of this health funding shortfall, and the precedent occurred last year. The precedent occurred when $107 million was taken out of the system, and then, by the way, the federal Labor government reinstated that $107 million to ensure that emergency departments were not closed. So this is not going to be the case with the Abbott government. The Medicare locals being abolished is this was another broken promise. They were told that it wouldn't. Now, I have a great Medicare local called the Southeastern Melbourne Medicare Local. I call it SEML. And it basically was awarded the budget for the headspace in Dandenong. It got it up and running in 4 months, Deputy Speaker, 4 months, and it is a great enterprise. Now, what's happened as a consequence of the uncertainty the Medicare locals have been abolished, is that the SEML was awarded a tender to establish a headspace in Narre Fountain Gate. Now, we have a real problem with youth suicide in my area, and that's why I've campaigned remorselessly to ensure that there was a headspace in Dandenong and a headspace in Fountain Gate. I was very confident, given that SEML had been awarded the contract for the headspace in Fountain Gate, that young people that I represented were going to get a community-friendly service that they desperately, desperately needed and deserved. What's happened with the abolition of this excellent Medicare local, which successfully has been running the program and the headspace in Dandenong, is uncertainty. It's been delayed. So if you think, and I say this to the government, to the Health Minister, you think after campaigning, given the level of youth suicide that we've had to endure in our area, getting a necessary facility that was being promised by the government, that you think we're going to brook a delay, you are delusional. That's just not going to happen. Young people in my area deserve these services, and we will ensure and campaign day and night until they get the services they deserve and they need. They were promised, and now this government's callously delaying it. That is just unacceptable. And we will continue to campaign until that gets fixed. We talk about pensioners. They sacrifice and labour for our country's good, and they're going to be told, well, people shifting into that age by 2035, that they're going to have to work until they're 70. That sounds great. Not if you're a construction worker, not if you're a tradie, not someone that works with their hands like so many do in my area, manufacturing as well. Deputy Speaker, this is a budget of broken promises, and lost opportunity which disproportionately affects people in our outer suburbs, and I would certainly ask the government to reconsider some of the more pernicious measures that have been introduced in this budget.